All right, everyone. Welcome. Happy June. Happy Pride Month. June actually has a lot going on in it. It's National Soul Food Month. And today is National Iced Tea Day. There is, of course, a difference between iced tea and sweet tea. The former is swill. The latter not only goes great with soul food, but is the nectar of imaginary supreme beings. It's also Teacher Thank You Week. And I'd like to think that teaching is within the scope of what we do here. So, here being Skeptical Inquirer Presents. This is a series of live online presentations from experts who are devoted to advancing science over pseudoscience, media literacy over conspiracy theories, and critical thinking over magical thinking. Sounds good? My name is Leanne Lord, and I am so delighted to be your host. I am a stand up comedian and an author, and the occasional co host of Point of Inquiry podcast. If you are so inclined, you can find out more about me and my work at veryfunnylady.com. Now, before we get going, I have a couple of reminders. The Center for Inquiry Coronavirus Resource Center is still continuing the work of curating reliable news at centerforinquiry.org/coronavirus. And this week, the Journal of American Medical Association is tackling the topic of mandatory SARS-CoV-2 vaccinations in K through 12 schools, colleges, universities, and businesses. And I think science based medicine absolutely wins the funniest headline of the week award. COVID-19 vaccines are going to sterilize our women folk. You guys, you just can't make this stuff up. All right. And if you have not already, I think you'd be well served to round out your reading list by subscribing to Skeptical Inquirer magazine. The new issue is out. Oh, I wish I had it. It just came in the mail the other day. And there are two ways to do that. It's digital and print. In bonus, the print subscription gives you access to the digital version. So you can get either or both at skepticalinquirer.org. And while you're taking notes, please mark your calendar for the next Skeptical Inquirer Presents. It will be on June 24th, featuring David Robert Grimes, who will be speaking with us about our ability to think critically and how it's, well, critical. Now, if you're new here, here's the deal. The flow of the evening is quick and easy. You keep doing what you're doing. I'll introduce our guest. They will razzle and dazzle. And then after that, we will open it up for your questions. At the bottom of your screen, if you're new or haven't done this before, you'll see an icon that says Q&A, and that's the place for you to type your questions in the form of a question. You know how I'm particular about that. And if you miss any of the talk and presentation tonight, it is being recorded and it will be available on skepticalinquirer.org. And now, here's the best part, everybody. Our guest is the science advisor for Science Up First, a national anti-information misinformation campaign in Canada that aims to combat misinformation around COVID-19. She is also the science communication lead for COVID-19 Resources Canada, leading a COVID-19 discussion initiative. She is passionate about countering misinformation and has been dispelling misconceptions around healthcare issues for several years. She is not new to this space. Currently, she has been sharing scientifically accurate information on COVID 19 with communities in Canada and Guyana. And she is an award winning and published researcher, only the best for you guys, and a very sought after speaker and science communicator, having presented at over 50 national and international events. We are quite fortunate to have her here tonight. And so, here to take us on a journey through vaccine education during a global pandemic, because when else would you do it? Please welcome Dr. Krishana Sankar. Krishana, thank you so much for being here with us. Take it away.
Thank you so much for having me tonight. I am really, really happy to be here and happy to join you all and share my knowledge with you. As was mentioned before, I come to you with several years of experience in this area, and I'm happy to take you on my journey during this COVID-19 pandemic. Of course, not a great time for for us in last year, but lots to share with you. So I will start sharing my slides because I was told that this audience loves the lecture. So here we go. So, ooh, are you actually seeing my slides? Awesome. So I'll start us off tonight by just throwing a couple of numbers your way. I think these numbers are just, they're necessary for us to look at, necessary for us to think about, necessary for us to ponder on. So far up until this date, we've had 3.7 million deaths due to COVID-19. So let that just sit with you for a little bit. 3.7 million deaths. That's 3.7 million lives lost to COVID-19 and 3.7 million families affected by COVID-19, having lost a loved one. And if you are someone who lost a loved one due to COVID-19 or due to anything else during COVID-19, because lots of those people have also been affected, I am really, truly sorry for your loss. It's been an extremely difficult time, but thank you so much for being here tonight. Another number, 175 million COVID-19 cases. So a lot of people, when I talk about COVID-19, sometimes tell me, well, they're looking at different percentages and talking about survival rates, but we have to consider the number of people in our world, not just the percentages, and each number is a life. And 175 million COVID-19 cases also means that a percentage of these people, even though they would have survived, how are they living? A lot of people actually suffer from long-term effects due to COVID-19. And so these can range anywhere from persistent headaches, and these are things that affect our quality of life and our living, as well as organ failure. So the list of different types of long-term effects from COVID-19 is actually quite long, but I just want you to think about these numbers. And I know there's sometimes people, perhaps you're in the audience or people in general, who are doubting whether or not COVID-19 is real, but I'm here to tell you that it is indeed real. So I will just tell you a little bit about my journey as a scientist, science communicator during this global pandemic that we've all been experiencing, and how myself personally, but also professionally, have been doing some vaccine education in order to help people make the most informed decisions for themselves, and also increase confidence in vaccines. So who am I? And I know I just had a lovely introduction, but I'll tell you a bit more about myself so you can know why I'm positioned to chat with you tonight, especially around this topic. So first, you'll see the first image here. This is one of my prouder images, but not my best image. So this is me in the lab. So I am a basic scientist, which means I work at the bench with petri dishes and tissues and cells that come from animal models. And so that's what I'm doing in one of the photos here. I'm sitting at a microscope. I'm trying to remove some tissue for a specific experiment I was about to do. In the second image, I'm there proudly holding my model. So I do a lot of science communication, which means I come to you, of course, pre-pandemic, I would be sometimes on the streets talking to people about my science, or now I'm doing this a lot virtually as well. And then the top image is me actually, so I am currently located in Toronto, Canada, so I should have probably led with that. But I'm actually Guyanese by birth. So I am from a small country called Guyana, which is located in South America, but it's culturally Caribbean or West Indian. So anyway, back to that image at the top. So I'm also an advocate. So my research previously around cell and molecular biology, I got my PhD at the University of Toronto, and I was looking at different types of ways to help treatment with diabetes. And so I became an active advocate on behalf of people with diabetes, and I would go to, I would be present at different levels of science and government in my advocacy. So Something I want to talk about briefly in terms of this pandemic, and I don't know about all of you, but I know for me and my colleagues for sure, we've just been bombarded with so much information during this time. And this is actually, a term was actually coined by the WHO that is called an infodemic. And what it is basically to say it's too much information that can include false or misleading information during a disease outbreak. So I don't know about you all, but there's just been a lot of information coming in to all of us on a daily basis. My colleagues and I are continuously pouring through information on a daily basis, trying to keep up with what's happening with the vaccines, what was happening with COVID, what was happening with masking, what's happening with airborne transmission. There's so many aspects to it. But unfortunately, because of that, we can get drowned out and be uncertain or unable to distinguish what's good and accurate information from what is not accurate information. And so this is where mis and disinformation come in. And you may have heard these terms before, but once again, I just want to define them for you. So misinformation is misleading information that may or may not be created with the intent to mislead people. And so an example of this could be, a rumor being started that a celebrity died when they didn't actually die. So that's a piece of misinformation. Disinformation, on the other hand, is more deliberate. So it's a deliberate attempt to actually use the information at hand in an completely out of context format in order to confuse and manipulate people. And so this one, they're both, of course, very dangerous, but disinformation is even more dangerous because it's sinister. It actually has something sinister behind it. And so for the purposes of this talk, I'll be just using the word misinformation as sort of just a catch-all term for both mis and disinformation when I'm talking about it. So when it comes to misinformation / disinformation, something in particular has come out, and research actually has found that in particular on social media, 12 very influential people, and they're called the disinformation dozen, who have been spreading a lot of misinformation or disinformation, but a lot of inaccurate information around COVID-19 and the vaccines online. And so this is one of the reasons why it's extremely, extremely important that we are able to decipher what is accurate and what is not, because this can actually affect our lives. We've been seeing that it has an effect on our lives. We've been seeing that it has an effect on Canadians. We know that it also has an effect on Americans, everyone worldwide. It's important that we're able to be able to critically think and suss out what is accurate, what is not, to make informed decisions so that we can protect ourselves and protect our health. So some of the devastating effects of misinformation, like I was talking about earlier, misinformation can affect someone's behavior. So anytime you've gotten a piece of information that will inform anything that you do. So for example, let's use an example of your car. If your mechanic tells you that your car tire, something's wrong with your car tire, what would you do with this information? It depends on what it is. Do you have a puncture in your tire or something else wrong with your tire? Do you need to change your tire for another reason? You will take that information, and with that information, you'll have a behavior attached to it. The behavior would be something that will lead to ensuring your safety. And so naturally, any information that we get, we will use it in order to ensure our own safety, our own personal safety. And so in this environment of misinformation, having inaccurate information can lead to lots of devastating effects. So for example, what we found is that people are not actually following public health guidelines. So one example of this is masking. And I know that there was a lot of controversy over masking, especially in the beginning of the pandemic, because of different people saying different things. But at the end of the day, we do know that masking is effective and that it works. So people not following public health guidelines like masking, not physical distancing, not staying home if they can when they are sick, can actually and has actually led to things like super spreader events. So I've got a photo here of a super spreader event that occurred in the Rose Garden last year. And that actually led to a lot of people testing positive for COVID-19. we need to recall, or we need to remember that these types of things will lead to spread and further transmission of COVID-19, which then affects a lot of very vulnerable people and then causes people to be in hospital and die. So we need to think about our actions. Another type of behavior is getting the COVID-19 vaccine. That would be a type of influential behavior that misinformation can actually lead to, whether or not people get the COVID-19 vaccine. And ultimately, we're putting lives of people and ourselves at risk if we're not actually able to access accurate information. So because of a lot of misinformation, so that's actually one reason behind it, we've been looking at vaccine confidence levels. And so throughout this talk, you'll notice that I'm not saying vaccine hesitancy, I'm choosing to say vaccine confidence. And that's because vaccine hesitancy, when thinking about this issue globally, we have to consider that every different environment and every different demographic has different uh, equity issues as well as accessibility. So for example, I can give you an example. I in particular live in a hotspot area or a high risk area where there's a lot of exposure to COVID-19. There's a lot of transmission happening. We've got the Delta variant right now. So it's really important that people within these areas are not hesitant, but we don't want to label them as hesitant because actually a lot of people do want to get the vaccines. But what we've been seeing is an issue of access. So a lack of access to vaccines means that people actually do want to get them, but they have a lack of access to them. So I would like to talk about confidence rather than hesitancy. Anyway, back to the confidence issue. Not withdrawing, not without considering minus the equity issues, we do have different communities that have vaccine confidence issues. And that's because of several reasons. So one, of course, was the mis and disinformation that I mentioned before, but also there's, of course, distrust of societal structures. So for example, government and healthcare. And if you're part of a specific marginalized or racialized group, you would know what I'm talking about. So different groups have experienced different types of mistreatment at the hands of government and healthcare structures. And so for this reason, rightfully so, these groups of people have distrust when it comes to medications and vaccines. The other thing is a lack of accessibility to scientifically accurate and vetted information. So I know the US, just like Canada, we have different populations here. For example, here we've got people from the South Asian population, we've got people from the Hispanic population, we've also got people from lots of different areas. And because of that, language is actually another barrier. But other than language, when I talk about scientifically accurate and vetted information, I'm also talking about simple information that's understandable by the public, but that is actually accurate. And what we've noticed is, although a lot of this information may be put on public websites and official websites, so for example, the CDC, or your local public health units, it may not actually be in accessible language to people who actually need this information. And another issue is low science literacy. So people being able to appreciate the fact that during this pandemic, although a lot of decisions have been changing due to incoming data that then informs policy, it tends to look as though scientists and experts are not sure of what they're doing. But that's not actually the case. What it is that we're learning as we go. And as we learn more data comes in, and this will start to inform policy, and the policies will change. So it's not about an issue of not knowing what's happening. It's just about an issue of understanding that science is a process, and this is how it works. So I have a graph here, and instead of you necessarily having to read the graph, what I'll show you, and what I'm really happy to see here, is that initially we had high levels of hesitancy or low levels of confidence when it came to people who were going to take the vaccine and not sure of saying no for sure they wouldn't take it, or yes, they would eventually take it. But what I'm really happy to see, and if you look at the graph, is that at least as of March 4th, and we know right now that it's actually increasing, is that we are now up to 66% on people saying yes, that they will get the vaccine. So we are seeing increases in the vaccine confidence level. And so that could be due to several different factors, including the fact that a lot of people are now seeing their friends and family getting the vaccines, so they feel like they also want to get the vaccines, and that's perfectly fine as well. So one thing I wanted to bring up, because of when it comes to vaccine levels and the infodemic and misinformation, is a lot of this we're seeing actually happening on social media. And because of this, several different experts came together and said we need a way in order to counter misinformation online, because we know that a lot of people actually consume their information on social media platforms, whether it be Facebook, Twitter, sometimes Instagram, and of course, even the younger generations on TikTok. And so because of this, we formed what was called ScienceUpFirst. So ScienceUpFirst, we came up with this idea or this name because we're thinking we would like to help people make accurate decisions. And to do so, they needed to think about the science first. They need to science up first before they make any decisions. Science up first is thinking critically about the information you're seeing, the information you're consuming, and then also the information that you're sharing, because we, as the entire of society, not just experts, we all have a responsibility to make sure that we're consuming accurate information and then responsibly sharing accurate information. So what's Science Up First? So essentially what it is, it's a national social media campaign that we developed to combat misinformation online. And so we are currently using different platforms, like I mentioned. So you can find us on Instagram, Twitter, Facebook, and TikTok right now. So let's see. So yeah, so why now? And I was talking previously about the rationale behind starting Science Up First. So like I mentioned before, we're in an infodemic. And let's be real, let's be honest, a lot of us we're all floating in this information. And if I didn't have the training that I have to be able to distinguish or suss out the accurate information from misinformation, I would be extremely, extremely lost. It's a very, very difficult time in order to tell what is accurate, what is not. And it's also a very scary time. So we need this type of initiative, especially on social media platforms where the people are, so that we can help people wade through the infodemic. Additionally, misinformation. So there's a lot of misinformation floating around that we want to be able to help people, once again, get the accurate information so they can know what is true and what is scientifically accurate versus what is not and what is fake. Lots of conspiracy theories are floating out around there. There was, of course, the whole 5G issue. Now we've got, magnets, vaccines magnetizing us. Obviously, that's inaccurate. I don't know if actually, if you go to Science Up First, and I hope you do visit our different social media platforms, we actually have a video that we repurposed from someone who deals with conspiracy theories, and it shows you that if you do put a magnet on your arm or any part of your body that's oily, it will stick. So it sticks just because of the oil. It has nothing to do with the vaccines. Anyway, and then lastly, right now, we know that all of this infodemic and misinformation is a threat to health and safety of Canadians and Americans and people worldwide. So who is part of Science Up First? So I know a lot of people, and especially during this pandemic, there's a lot of trust issues. People are not trusting of different entities as they used to be, and that's understandable because it's in a frustrating time and you're trying to figure out who should I trust, who's being transparent, who's being open. And so I'd like to, I hope I'm able to, if you are having, concerns and worries and distrust in certain entities, I hope I'm able to help you navigate that. So we're actually independent scientists, healthcare providers, we have social science communicators, we have social science researchers, and information experts who are part of this initiative. And of course, we're only using trusted sources of information, but we ourselves have expertise in, for example, communication as well as science. So we help to vet the information. And we have an executive advisory board that also includes community partners. So one aspect of the initiative that's very important to us is to ensure that we actually are able to get and find out from different communities what it is that they're missing, what are the gaps in the communities, what do they need help and support with. And so if we are able to do that, that's where we want to be. So how are we actually doing this? So right now it's a very cyclical and iterative process where what we do is we gather information. So we're taking information in around what's happening in the world. We're getting information from our online community. So we're getting feedback from our social media platforms. We're getting feedback from our community partners, but we're also getting feedback from data. So we're collecting data from online resources. So we're collecting data, for example, from social media. We also have access to other data, like for example, around Google searches, trying to figure out what is it that people are looking for? What are we missing? Are there any gaps that we need to fill when it comes to putting accurate information out there? Our team then brings that back, researches it, looks into the content we need to create, and then creates engaging, simple, and shareable content. Obviously, it has to be accurate as well. And so for that, we actually have a process where we have experts come in and vet this information, then send it back to the team. The team ensures that everything is wrapped nicely in a package so that's easily absorbable and consumable for our followers. And then the content is then published on our social media platforms. So what I'll say right now is the campaign is doing fantastically. We've been getting lots and lots of great feedback, so we're very happy for that. What I will say is that I would definitely encourage you to check it out. It's really a great space to get accurate information, but in a very easy to understand way, which I personally appreciate. I myself actually use the platform and the content a lot to share with a lot of my friends and family whenever they have questions. So what we do, for example, we take very timely topics that are coming up and we create content for it. So for example, if you have issues or thinking about what's happening with mixing and matching of vaccines, we've got a post for that. If you're thinking of the magnet issue, we've got a post for that. I know very early on, the issue around fertility, and fertility has been a question that I've received so many times. We have a post for that. So check out the website, which is ScienceUpFirst.com, and then check out the different social media handles, and we have content there. So this is one of the ways in which I personally and professionally have been involved in handling misinformation. But another way, and a more, for me, quite frankly, I find this a more fun way of doing it, is I've been involved in a lot of vaccine Q&A sessions, and I've been doing them in Canada and in Guyana. So here I actually have an image of us. So this I was doing through an organization called COVID-19 Resources Canada. And we started doing these vaccine Q&A sessions in the beginning of January of 2021. And so the reason we actually did this is because we were monitoring what was happening throughout of course, from the beginning of the pandemic up until we knew that the vaccines would be developed and then put in the market for a launch and a rollout. Unfortunately with us, and I know the same happened in the US, is that there was a lack of a vaccine education program to complement the vaccine rollout. And obviously because of lots of things, including the very quick what seems to be a very quick development, but very quick launch of the vaccines caused a lot of people anxiety around taking the vaccines. And that is understandable, especially if you don't understand what the process was like. And so what needed to happen was there needed to be vaccine education programs to complement what was happening in the rollout. This was not happening at a governmental level. So once again, we took on a grassroots approach and we started doing these vaccine Q&A sessions every single night. So we did them nightly for 3 months, from January to March, 7 nights a week. A bunch of scientists and clinicians joined together. We hopped onto Zoom and then we just essentially advertised and let people know that we are here to answer your questions that you have. So at first we actually tried to reach the people who were first in line for vaccines. So those were the seniors, the healthcare workers, and the personal support workers at long-term care homes here in Canada. They, of course, had very high levels of hesitancy or low levels of confidence in the vaccine. And so we literally spoke to them nightly about their concerns around the vaccines. So this happened for a period of 3 months, after which we reassessed because burnout is real, and wanting to make sure that we also took care of our own selves while we did this. We realized we needed to sort of pare back a bit, and we started to do it 3 nights a week. So it's currently on for 3 nights a week, Mondays, Thursdays, and Saturdays from 8 to 9 p.m. Eastern time. And we also do what's called special sessions. So a lot of different organizations actually come to us and ask us to hold these sessions for them. So this image right here you're seeing is actually an image of a few experts, including myself and some colleagues. So we held one of these Zoom Q&A sessions for our Minister of Health, and that is Patty Haidu. And so this is just a screenshot of that Q&A session. And this is essentially how it looks. We invite people into a Zoom session. We let them know we don't typically record these because we like to have it as a safe space so people can come and ask their open, honest questions, and then get open and honest, responses in return. Some people may share medical information, and so for that reason as well, we also don't record the sessions, and we sort of keep it as a closed door type of event. So to date, we've reached between 1 to 2,000 people at least, and worked with over 50 organizations, and we've done countless events by this point as well. And we're continuing to receive really positive feedback. There's some people who were hesitant or had low confidence, who then said that talking to us really helped them to make their decision to move forward with the vaccine, or knowing, for example, what their best option was when it came to taking the vaccine, because of course there are different types of vaccines out there. Right now, of course, there's the issue, at least in Canada, with mixing of vaccines, and a lot of people are wondering what to do. So these are types of feedback we're getting, which has been great. So another place that I've been doing vaccine Q&As has been in Guyana. So Guyana, my home country. I've done several of these Q&A sessions there as well. This here is just a poster of one of the Q&A sessions I did with my colleague, who happens to be a physician back there. And I've been doing a lot of outreach. And so actually, although I am in Canada, being able to speak to the people back home for me was really important, because there was also quite a bit of low confidence in the vaccines, as well as the fact that it's a small country that had a relatively high case percentage. So COVID-19 cases, and unfortunately increasing deaths. So it was really important that we spoke to people, or at least that I was able to help reach people back there, and try to understand what their issues and fears and concerns were, but then be able to tell them, what it is that the vaccine can give you, and try to answer any of their questions. And so far, very fortunately, they've managed to ramp up their vaccine administration extremely, extremely well. So that has been very exciting to see. So what I want to turn to right now is just a couple of different things. So first of all, a couple of tips on how you yourself can empower yourself to know, am I reading crap? Is this crap or is this not? And so there's actually a method called CRAP. So it's an acronym for being able to actually determine whether or not you're consuming accurate information. So when you think of CRAP, it's currency, relevance, accuracy, authority, and purpose. So currency meaning, is this information current? This is really important, especially during this pandemic, because like I mentioned, we also are experiencing an infodemic, which means information is constantly coming in. What was true yesterday may not be true today. And we really need to be on top of it. And literally, some days, I would go on a vaccine Q&A call and I would be ready to answer questions. However, that day, perhaps our National Advisory Council on Immunization might have made a decision based on some data that came out yesterday. So suddenly now, when it comes to that kind of information, I would no longer be up to date, literally within minutes. So you need to be able to know that how current the information is that you're consuming. The other thing is relevance. So does the information answer the question that you're asking? Right. So if you're talking about are there metals in the vaccine, and then you're seeing information about magnetism, is this answering your question, or is this just giving you fake information? Accuracy. Is the information supported by evidence? This one is huge. So right now, once again, it's very difficult to navigate, and being able to trust experts is important. Now, this one, I will say, it is difficult because sometimes you'll see experts having dissenting opinions on things. And what is really important is the scientific consensus. Now, I know a lot of people, they think that, oh, well, it's okay to have a differing view. But the thing is, how science works is the data is the data. And if a lot of people, a lot of experts actually interpret the data one way independently and come together and have a consensus, it actually would more likely mean that than someone else being just one off on the side, sort of shouting. It does not mean that. And so most times than not, scientific consensus is what we need to follow, because it means several individuals came to the same conclusion about a piece of data, which is important. Now, authority. So who is the author and what are their qualifications? Is this person actually a trusted person? Are they, for example, a veterinarian versus a virologist? It makes a difference on who's talking to this piece of information. The purpose. What are the author's intentions? Are they clear? This is really important. Do you know if this author has something financially, for example, to gain from writing the piece that they're writing, or do they not? Have they actually declared any sort of conflicts of interest? These things are very important to know. And I know a lot of people are very careful when they look at it, but you need to be critical as well. So I want to actually get into a personal story of how I actually helped my grandma. So this is myself and my grandma, and we were interviewed for an article in Toronto Life, because she was actually initially hesitant or had low confidence about getting the vaccine. And why was this? So I actually had with her. So this actually came about because I would visit her, and sometimes I would overhear her conversations with her friends. And of course, in the grandma network, everyone's up to date, especially during a pandemic. So I started to hear her talk about the mRNA vaccine. So of course, this is in the very beginning when the vaccines came out, and everyone was in an uproar about this mRNA vaccine. What is this? This is brand new, and so very much understandable. So I heard on our conversations her talking about, not being comfortable because she had no idea what this mRNA vaccine would do to her body. She's saying that she was not going to take it. What is happening? What's in it, and what will it do to her? So I actually, over time, had several conversations with her. I think what was really important is that I had to sit and listen and have conversations with her to understand what her fears and concerns were. After that, being able to actually guide her through what I knew to be true and what I knew to be the data around the vaccines, and also tell her and for anyone to know that one of the ways in which for us to get out of this pandemic, other than using a trusted treatment or a vaccine, is to do that with public plus following public health measures, because that's the only way we'll be able to start being able to socialize again. So one important thing that's been missing is our social aspect. We've all, of course, been isolated for such a long period of time, and being able to be with our friends and family again, socialize again, travel again, just move freely again is so important. And I know a lot of this is happening in the US right now. Unfortunately for us in Canada, we're not quite there yet, but these are things that we need to continue doing. And so I'm happy to say, because of several conversations and then her also chatting and sharing the information I shared with her friends, she actually got her first dose of the vaccine, I think in early March, and she's about to get her second dose. So I've had quite a few conversations like this, not only with my grandma, but of course with friends, also with my telecommunications person. So I calling in to complain about my bill, my phone bill, and actually having the person on the other line actually starting to have a chat about the vaccines. And so that was very interesting. And so I do a lot of this on a very frequent basis. So with that, I want to say, just share a couple of things that I mentioned is, if you are someone who are trying to, try to talk to someone or a loved one about being able to protect themselves and they have not done so yet, how can you actually have conversations with loved ones? And these are the conversations that are the most difficult to have sometimes, because these are the people closest to you. So we tend to get most frustrated, when we're not on the same page. And I think listening, number one, listening is so extremely important. We have to listen. A lot of us are, when we're in conversations, we're not actually actively listening. We're listening, or we're just waiting to actually say what we want to say, but we're not actually listening to what the other person is saying. So being able to listen so you can take in what they're saying is important, because you need to be able to be compassionate with the other person. We are only able to actually relate to someone else if we are compassionate. If we're approaching a situation in an attacking way, that will obviously never work. If you think about it, if someone comes to you and they're trying to change your mind about something, and they come at you in a very, defensive mode, or an attacking mode, it definitely will turn you off, and you won't want to listen to what they have to say. So the other thing is, you want to be able to correct the inaccurate information without attacking them, right? So that's what I was talking about. So have accurate information at the ready. Of course, if it's simple and understandable, and you're able to point them to an original source, it would be very helpful for people. And then, of course, again, share that accurate information. So not only going through why the piece of information was inaccurate, but also sharing the accurate piece of information. And so now I'm near the end of my talk, and I want to talk about what is on the horizon. So right now, and this data is coming out, from um, our world in data, and it's so extremely exciting. So right now, we've administered at least over 150 million doses of the COVID-19 vaccines. And so whether or not you're a believer, the data does not lie, and this graph here is beautiful. So it's showing you from March last year, where we saw that the spike in cases, we saw a lull. And if you notice, a lot of the inflections and the waves are sort of being mirrored in all different countries due to a lot of similarities of things happening and variants coming up. But now, if you look at it too, then we also started to have our vaccine. It started to be administered for some countries December or January. We had another huge spike in cases. Again, you see in the UK, and so of course this graph is a little bit condensed. But basically, as vaccine rollout ramped up, we actually started to see a drop in cases and a drop in deaths. And that's extremely, extremely important, and also extremely telling that the vaccines are effective. And so this drop in deaths is not due to anything else right now but the vaccines. So I want people to keep that in mind. So this is just a photo of me I thought I would share. I am now fully vaccinated. I got my second shot of Pfizer vaccine, if you would like to know, on Monday. So now I'm fully vaccinated. It takes 2 weeks to develop immunity to the vaccines once you've had it. So I'm good to go after next week. I will have full immunity from the vaccines. In terms of side effects, what did I experience? So actually, on the very day I actually felt the prick on the first time I did it, I had a sore arm, I had a little bit of a headache, and I was very, very tired. But those are sometimes expected effects for people to have. And so otherwise, as you can see, I'm doing fine. Some of the feelings I had, such gratitude and relief to know that, this will then help the rest of us get out of this pandemic and also be able to open up very quickly. So I will leave this question to you, and I would love to know what your answers are. But what are you excited for after you're vaccinated? For me, a couple of things. I'm excited to hug friends and family. I'm excited to go back to Zumba. So this is a photo of me. I've been, I've trained in dance for many years of my life, and I now teach Zumba virtually. So this, I thought I would share that piece of personal bit with you. And so I'm excited to do these things again, but in a social setting, because I have missed it so dearly. So think about that, and please share it with me in the chat. A couple of last few things. So some trusted resources. Your personal healthcare workers. So your, physicians, those, physicians, nurses, nurse practitioners, pharmacists, community pharmacists. These are excellent resources for you. So if you have questions, go and ask them. Local health units are also great places of information. Science Up First, check it out. So at Science Up First, Twitter, Instagram, Facebook, TikTok, and scienceupfirst.com. And I know a lot of people have lost trust in organizations like the CDC and the WHO. But what I will say is, unfortunately, I think a lot of the issues came from communications that were coming out of these organizations. And then it's not that they're not trustworthy, it's just a lot of the communications were not handled well. And so please, please, please be able to use these different resources whenever you do need them. So once again, this is the information for Science Up First. And then lastly, if you would like to connect with me, you can find me on these different platforms. I'm on LinkedIn, Twitter, and Facebook. And that's it from me for tonight.
Krishana, thank you so much for that.
Awesome.
Wow, I had no idea we had Zumba in common.
Awesome. Should I stop sharing my screen or should I keep it up?
Oh, no, you can stop sharing. You can
Okay.
stop sharing so we can, we'll screen share together. Let me change my view so that we are side by side. So good to, thank you for that. And yes, I cannot wait to do Zumba again. Me doing it in my living room by myself is kind of weird. My, well, at least my cat.
That's why I do it with a class, right? Because you need that social aspect to it.
Love that. I love the Zumba energy. Right now, my cat just looks at me like, this again. We're doing this thing again. Yeah, he doesn't participate. So yes, Zumba, hugs, getting out back into the world, for some semblance of a life. These don't seem like big things or hard things, but after last year, I guess they are. We didn't realize how much we were taking for granted.
Exactly.
And yeah, you said we do have some questions here, but you said so many things that really resonated for me. I wish we could find a way to really mobilize that grandma network,
Yeah,
because it's not just you. It's not just you. I'm West Indian. I've got Barbados, Trinidad, and Jamaica. So a lot of curry, a lot of curry, a lot of discipline, a lot of grandma networking. And the fact that you took the time to talk with your grandma and that she listened, and it wasn't just one conversation.
No, it was several conversations.
Yes. And even the impromptu conversation between you and the telephone person.
Yeah.
Like you never know where these opportunities will arise for you to, input your expertise and dispel some misinformation and maybe even some disinformation. And I like that you call it vaccine confidence, or lack thereof, because that's I think that's more comprehensive, a definition. So thank you for that. And wow, is this crap? I wrote that down and I screenshotted it because I was like, yeah, because I check in with my friends and there was a point where it's like, okay, are we wearing gloves in public? Or we're not doing that anymore now? Are we touching stuff? We're not touching stuff. And it's like, and we're not even in the business. We're just people trying to survive. And it's like, where are we now?
Yeah, it's difficult.
Yeah. So to know that it's even challenging for you, but I love that crap acronym. That is, we should be doing that anyway for all news.
Exactly, for everything. Yeah, for everything.
Yeah. But we have quite a few questions here. Let me jump in. Let's see. I think we can just start right at the top because this is a good one from Jack Holmes. Thank you, Jack. Do you think that we may need boosters? Also, animals should not be used in the research as we can't be proven to help and suffer as a result. That's more of a statement. But will we need boosters?
That's a question. Yeah. So that's a common question that we get asked. And to be quite honest with you, we don't know yet. A lot of that has to do with, how successful we are once we are finished with the current vaccine campaign that we have going on, the current vaccine rollout. We will continue to see, if we're able to get majority of people vaccinated to potentially get to herd immunity, we'll see less and less mutations of the virus. And so in that case, we may not need to have booster shots. However, if we're missing that, if we miss that altogether, we may need booster shots in the future. But that, again, is not something, we have a definitive answer on yet.
And you reminded me of something that I had wanted to ask. Is the vaccine confidence or hesitancy um, high in Canada? Is it as bad as it is in the States, or is it comparable? Because
Yeah.
I don't know why I sort of look to our neighbors in the north as being the level-headed ones. But perhaps I might be, swayed by the Tim Hortons coffee. I could be wrong.
Yeah, sometimes the things that happen here also surprise me. So I think right now, from the last bit of information I got, I think hesitancy in the US is somewhere around 26%. I'm not quite sure. I haven't seen the actual number. But with us, we're actually doing quite well right now when it comes
Good.
to confidence. So with that graph that I showed you, we did start
Mm-hmm.
low. We did start low on confidence, which means our hesitancy was high, but we're now improving in our confidence. And like I said, so I think and I think it's probably we may be doing slightly better than you folk down, south, but it might start to be comparable. It's sounding like your vaccine campaigns or your rollout is actually doing quite well in the U.S. I mean, to be honest with you, we're quite a lot of us over here are very jealous. So many people have, so many people were initially vaccinated compared to us, but we are catching up in our vaccinations. But I will say yes, confidence is increasing around in many communities, which is great for us right now.
Awesome, awesome. Have a question from Steve. Hey, Steve, nice to see you. I guess in quotes. And Steve wants to know: do we have any legal recourse against these? Against like the disinformation dozen? And I do have a list of people want to know. Believe that was put in the chat for everybody. They're individuals that they're actually a public danger. Is there any recourse against people who are doing this?
Yeah, that's a really great question. To my knowledge, not right now, but I know what some of the social media platforms started to remove some of them from the platforms. So I believe 3 of them have been removed from Facebook, but people are actively trying to get the rest of them off of all social media platforms because they're extremely, extremely dangerous. Like their reach is massive and they're causing
Yeah.
lots and lots of hysteria and chaos. That's it's dangerous. It's causing issues to our public healthcare system. So unfortunately, right now, no, I don't believe there's any legal recourse to it. Unfortunately.
That might be something worth exploring again, because of the implications.
Exactly.
As you
Exactly.
said, people are making decisions, life decisions based on misinformation.
Right.
You know,
Exactly. Yeah.
yeah. Peter Patel wants to know, what is your opinion, and I'm gonna probably mispronounce this, on using ivermectin as preventative slash treatment drug for COVID-19. Did I say that correctly?
Yeah,
Is it
ivermectin.
recognizable?
Yep, yep. Yeah, so this has been a big one, and I know it's been used in certain countries. So for us over here as preventative, right now the only thing for prevention would be the vaccine over here. So my opinion on that is a no.
Okay. And on the heels of that, Matthew asked that, he's heard from friends in Canada that they were unable to get vaccinated. Has that situation changed?
Yeah, so unfortunately right now, like I was mentioning, our rollout hasn't been the best. I don't think the rollout has been the best anywhere, to be quite honest. But it's been messy. Right now there's an issue around so we're talking about the mixing of the vaccines, and why that even came up as an issue right now is because of the issue around AstraZeneca vaccine and the unfortunate but rare clotting side effect. So the people who've gotten AstraZeneca are now told to wait their 12 to get their second shot.
Oh,
But they're,
wow.
yeah, so they even have to wait 12 weeks for another shot of AstraZeneca or an mRNA vaccine. And right now, like a lot of us are advocating for us to shorten that timeline. So people, especially if you're in a high risk area, you
Yeah.
need to be able to get your second shot soon. We've got the Delta variant here, which is, it's extremely highly transmissible. It's also being found in a
Mm,
lot more people going to hospitals. So we need to be able to vaccinate people and for them to get their second dose as soon as possible.
right. Thank you. Um, this goes to one of your later slides about how we talk to family, friends, and loved ones. And Mary, and you sort of answered it, but I just wanted to say this anyway, that Mary said that she's tried. My whole family has tried, but my 95-year-old mother is convinced of every single conspiracy theory about the vaccine and will not get it. Any suggestions?
Yeah, you know what? That's something I didn't touch in my talk, but unfortunately, we can't get everyone. There's some people who are just immovable. No matter what it is you do, they're immovable. What I will say is this, and it's not maybe the best thing, but I will say this is on some of the vaccine Q&A calls I've done. I had a grandma who came on, and she also was buying into a lot of conspiracy theories, but she also shared with us that her I believe her daughter-in-law was not willing to let her see her grandkids unless she was vaccinated. And so in a way it's forcing her to do it, that she doesn't really want to do it, but that actually made her get the vaccine, because otherwise she really wasn't going to get the vaccine. And sometimes there are just some people who are so bought into the conspiracy theories that they're very difficult, like you won't even reach them. So for people like that, quite frankly, for me, I don't even try. If I notice that I'm starting a conversation and they prefer to more have attacks and they're constantly asking me about the conspiracy theories, it means that they're not open-minded, or they're open to having discussions around the data and different information. Then sometimes it's not worth my energy. But this is a different circumstance. It's your mom, so I know it's very difficult and dear to you. I don't know if she's been able to see, her grandkids, if that matters to her. Maybe you would like to try that tactic. That's something, like I mentioned, that grandma did share with us.
Mm, okay, thank you. That's a hard one. That's
It's
really hard.
difficult. It's really, yeah.
Um, Kasar, my apologies if I am mispronouncing your name, but they say vaccines take years to develop and be considered safe. How do we know for sure that there are no long-term side effects of this
Mhm.
vaccine?
Yeah, so this is a question we get often. So,
Yes.
yeah, and it's an understandable question. So, what I want to say is this: the reason behind vaccine development taking so long is usually there are many reasons. There are many factors to it. For vaccines or any clinical trial to happen, you need to be able to enroll a lot of sick people into the trial, and most times that takes a really long time. But in a pandemic, it's very quick because so many people are sick. It's very, very easy to enroll these people into a trial. So that's number one. No, the availability of people who've actually had COVID and want to get involved in the trials is immensely different in a pandemic versus a regular situation. So sometimes it takes years to recruit people. In this pandemic, it literally took a very short period of time. Number two, the trials actually started in March of last year. A lot of things started very, very quickly because of all of the information that was coming in. So these things have been started quickly. Number three, the technology behind the vaccines actually have been known. The reason why, particularly for mRNA vaccines, they weren't brought to markets because, again, another resource that was missing all along is money. A lot of money is involved in research. If you can't fund it, it won't happen. And so in a global pandemic, if you can imagine, it's a global pandemic. Every single country is being affected. A lot of money was poured into COVID-19 research and COVID-19 vaccine development. And another thing is typically, if you're not in a pandemic, think about it, right? Like we have people working in regulatory and government, like health and regulatory. It takes time for a lot of the red tape, unfortunately, to move along when you're moving, drugs and vaccines along. But because once again, we're in a pandemic, a lot of that red tape was removed and things were moved along quicker than if you were, just working your regular day job and people were just taking their time, right? So those are some of the factors around it. In terms of long-term side effects, so what I did want to say is this: what we've known from years and years and years of using vaccines and medication, well, specifically vaccines, is that long-term effects from vaccines typically show up within the first 3 to 4 months maximum. We have not in the
Okay.
history of medicine seen any long-term effects beyond 4 months. Additionally, you have to think
Mm.
about it. The vaccines have been administered from March of 2020 up until now. We're June, so we've been over a year, and no other signs of any sort of effects have shown up from the vaccines, and we're over a year right now. Also, like I mentioned, over 150 million doses of the vaccines have gone out. So if anything were to happen, we would have known what it is by now. So the things that we have caught, for example, is that rare side effect of blood clot from AstraZeneca vaccine. That's something, but it
Mhm.
showed up. It showed up under a month. So those are things to keep in mind that we haven't, and like I said, in the history of vaccines, typically long-term side effects beyond 4 months have never been seen.
Okay. We are almost at 8 o'clock, and I want to get to this. It's a long question from Connor, and I think it's worth asking because he really did write it out thoughtfully. So, do you have a couple of extra minutes?
Sure. Yes, no problem.
Okay. All right. And Connor, thank you. I will try to do this justice. Once again, this type is so small and sans serif does not help me. But Connor says that there are legitimate concerns about these mRNA vaccines substantiated by leading scientific experts in peer reviewed literature. For example, we know that lipid nanoparticles from the Pfizer vaccine concentrate in the ovaries, and that the spike protein itself is harmful. You're okay. You're already shaking your head. We don't know this. Okay. Well, I guess what he's really saying is, how do we? Okay, wait. I'll read the whole thing. There are thus legitimate concerns about the long-term reproductive health, but these concerns are drowned out by conspiracy theories. How do we upgrade the conversation to leave behind disinformation and bad actors, and instead focus on reasonable concerns and a growing body of evidence of harmful effects of these vaccines? Do you see why I asked? Because if this is what people are thinking, you know,
Yeah, so this is actually extremely bothering to me because the funny thing is, what Connor mentioned is actually the disinformation. So this piece of dis/misinformation has been circulating recently, and actually, unfortunately, has been peddled by a virologist here in Canada. So a Canadian virologist
mm,
has been peddling this. And so what it came from, unfortunately, so several things. He was over/misinterpreting data that came out that were looking at the spike protein. So now a couple of things I want to say. The spike protein itself is not dangerous. Number one, the spike protein on the virus itself is dangerous. And that's because also it's the entire virus. The spike protein is one tiny piece, and it is the mRNA or the genetic material of that spike protein that's used in the vaccines. So it is just a tiny piece. Also, the part of the spike protein that is used to attach to other cells that makes the virus dangerous is actually not part of the spike protein in the mRNA vaccine. I think that's very, very important for people to know. There is a huge distinction. So that piece of spike protein that we get the mRNA for in the vaccine is not dangerous. It does not cause any kind of clumping or accumulation. The studies that this particular expert alluded to when he was talking about the fact that the spike protein accumulates, even the authors themselves debunked what he said and said the conclusions say nothing of the sort. The reason that the study was done was plainly and simply to show that yes, the vaccine does indeed produce spike proteins. So this study was super small, and this is another thing that I want people to be careful and cautious of. This study was out of Harvard. It was 13 people, and 3 out of 13 people, they saw that the spike proteins were still around in their blood for 15 days. It did not show that there was any accumulation in organs. It didn't show any negative side effects from the spike protein still being around. But that's 3 out of 13. Now, if you think about it, typically in vaccine trials, we have to have at least 30,000 people to make any kind of conclusion of anything. And so that's very important. The study authors themselves from Harvard also said that that conclusion that that expert was drawing was extremely and absolutely false. That's not anything that it has, nothing like that can be made as a conclusion from that study, number one. The other part of it, I think, had to do with accumulation again, was from a Japanese study Once again, the author said it had nothing to do with that. There was no signs of accumulation of spike protein or any kind of toxic side effects of the spike protein happening anywhere in the body. And so that's why I think people need to be careful. So the mis and disinformation is actually that, saying that the spike protein is toxic and accumulates. That is the conspiracy theory, not the fact that it's actually not. And that's because, like I said, that expert over and misinterpreted the data that he saw in the study. We can't say anything from 3 out of 13 people. That's not large enough to say anything, and they did not actually see any sort of negative side effects. So I think that's what's important for people to know. If something changes in the future, so say, for example, it was a large study with a significant amount of people who they actually saw negative side effects happening from the spike protein accumulation, then that's different, right? At that point, we have to change what we are saying. And that at that point is not a flip-flop. It is, we're saying what is actually happening at that point in time based on the data we have available to us. So right now, with the data available to us, that is inaccurate. So I want to make that clear. Also, the issue with infertility, that also is a conspiracy theory or a piece of dis and misinformation. Once again, people were talking about a protein that is found on the placenta and saying that the spike protein, so there's a protein that's found on the placenta called citizen, I forget the way that you call it. There was a protein on the placenta, and there's the spike protein. What they're saying is that there's a lot of similarities between the two. In actual fact, there isn't. So when scientists look at it, there's literally, as though you're saying on a, I don't know, 1,000-foot or 1,000 alphabet, something. You've got like 3 pieces or 3 little pieces of the alphabet in it that's similar or in the similar order to something else. That's not enough. That's not enough similarity to say that the 2 proteins are similar. And it does, and what it means is that it cannot interact or interfere with that protein on the placenta. So no, right now there's no evidence to say that the spike protein affects, or the vaccine, which causes the development of the spike protein, to affect fertility. So that's inaccurate.
I am so glad Connor asked that question. No, and gave you the opportunity, wow, to really dive into that and show your stuff. And I think that's a great question. No, actually, that's a great answer. To wrap up on, Krishana, thank you so much. That was definitely worth taking a few minutes over the hour
Definitely.
to get to it.
I am happy that Connor asked it, because it is something that's been circulating and unfortunately causing a lot of fear in people, which I can understand. But I want people to understand that the data was taken out of context, and that's why we have to be very, very careful about what it is we're reading and believing.
Right, and I believe that's part of crap.
That's right.
Currency, relevancy, accuracy, authenticity, all of it.
Yeah.
But again, Krishana, thank you so much for your time. I really appreciate it. And to you in the audience, if you've missed anything of this presentation and this conversation, the recording of this event will be available tomorrow at skepticalinquirer.org. Please join us on June 24th for a talk on critical thinking with David Robert Grimes. He will be with us. And of course, my thanks to Skeptical Inquirer, to the Center for Inquiry, and our producer, Mark Kreidler, as always. And of course, to you, the audience, thank you for choosing to spend your time with us this evening. My name is Leanne Lord. Thank you and good night. Krishana, thank you so much again. You have a really good night.
You too. Thank you for having me.
Bye.